Have you ever stopped to think about how a simple thought like, I want to take a step, actually becomes an action? Well, today we're taking a tour of your body's incredible command center, this amazing network of cranial and spinal nerves that links your brain to, well, literally everything. So let's plug in and explore the wiring. I mean, really think about it. How does your brain talk to your toes? It seems like such a simple question, right? But the answer is this absolutely beautiful piece of biological engineering. So, how does a decision made way up in your head result in you wiggling your toes? The secret is all in the body's incredible electrical wiring. And this is it. It's called the peripheral nervous system. Just imagine it as this vast, complex highway of electrical cables. These cables carry messages from your central command, that's your brain and spinal cord, out to every single part of your body. And at the same time, they're sending all that sensory information right back. This is literally how you feel, how you move, and how you experience the entire world around you. So, our tour is going to start at the very top, with the real VIPs of the nervous system. These are the cranial nerves. Think of them as the direct, private lines that come straight out of the brain and brainstem, and they mostly handle business for the head and neck. And how many are there? A nice, neat dozen. That's right, 12 pairs of them. Every single one has its own specific name, a number, and a really unique job to do. Let's try and break them down by their function. It makes it way easier to understand. Okay, first up, let's talk about the nerves that literally build our reality. You've got the olfactory nerve. That's what lets you smell that fresh coffee brewing in the morning. Then there's the optic nerve, which is what you're using right this second to watch this. And finally, the vestibulocochlear nerve. This one is a fascinating two-for-one deal. It handles both your hearing and your sense of balance. Pretty cool, right? Now, just for a second, think about following a bird flying across the sky with your eyes. That seemingly simple action requires the perfectly coordinated teamwork of three different nerves: the ocular motor, the trochlear, and the abducens. It's this delicate little dance of tiny muscles and incredibly precise signals, all happening in a split second. All right, now for the nerves that let you interact with the world. Your trigeminal nerve, that lets you feel a gentle touch on your face and gives you the power to chew your food. You can thank your facial nerve for every single smile, frown, and surprised expression you've ever made. And the hypoglossal nerve, that one controls your tongue, which is absolutely essential for both speaking clearly and eating. We're going to finish our little tour of the cranial nerves with these guys, the deep operators. The glossopharyngeal nerve manages taste and that all-important gag reflex. And then you have the famous vagus nerve. Its name means wanderer because it travels so far. It doesn't just control your voice and swallowing, it also connects to your heart, your lungs, and your gut. It's a huge player in that mind-body connection we hear so much about. And finally, the accessory nerve lets you do a simple shrug or turn your head. Okay, so we've moved on from these specialized direct lines serving the head, and now we're hitting the massive superhighway that connects the brain to the entire rest of the body. It's time to talk about the spinal nerves. And this right here shows the difference perfectly. So we've got those 12 pairs of cranial nerves taking care of the head, but get this, we have a whopping 31 pairs of spinal nerves that branch off the spinal cord to service everything else, from your shoulders all the way down to your little toe. And those 31 pairs are all neatly organized by where they pop out of the spine. We've got 8 pairs up in the cervical region, that's your neck, then 12 in the thoracic region, which is your upper back, 5 down in the lumbar, or your lower back, 5 more in the sacral region, near your pelvis, and then 1 final little coccygeal pair at the very bottom. And each of these regions has a very specific job to do. So you might be wondering, how on earth do we make sense of this gigantic network? Well, it starts with a really cool concept called a dermatome. The best way to think of it is as a sensory map. See, each spinal nerve is responsible for feeling things like touch, pain, temperature from a very specific patch of your skin. And all together, they create a complete sensory map of your entire body. Let me give you some classic examples to make this real. If you feel something on your thumb, that signal is actually traveling all the way up to the C6 nerve root in your neck. The sensation right at your nipple line, that corresponds to the T4 nerve in your upper back. A feeling on the inside of your leg is linked to the L4 nerve in your lower back. And the outer edge of your foot, that's S1 territory. It is an incredibly precise system. Okay, so if dermatomes are the sensory map, all the information coming in, then myotomes are the movement command chart, all the instructions going out. A myotome is basically a group of muscles that are all controlled by the motor fibers from one single spinal nerve. This is how the brain's command to move it gets delivered to exactly the right muscle. And this creates a really direct link between a nerve and a specific action. You want to flex your bicep? Do a curl? That's your C5 nerve root firing up. Extend that same arm using your triceps? Now you're using C7. Kicking a soccer ball uses the L3 nerve for your quadriceps, and just lifting your foot up is powered by L5. So we have this absolutely amazing map of sensation and movement laid out across our bodies. But so what? Why does understanding all this matter so much? Well, it's because this system allows doctors and clinicians to decode signals from the body and pinpoint problems with incredible accuracy. Let's start back with the cranial nerves. You know, when a doctor asks you to smile or puff out your cheeks or follow their finger with your eyes, they're not just making small talk. They are systematically testing these 12 nerves. And any weakness or issue acts like a giant flashing arrow, pointing directly to a specific area of trouble, what's called a lesion, somewhere inside the brainstem. And that exact same logic applies to the entire rest of the body. So if a patient comes in with numbness along the outside of their foot, hey, that's the S1 dermatome, and they also have weakness when they try to push their foot down, that's the S1 myotome, a doctor can be very confident that the problem is with the S1 nerve root, way up in the lower back. It's like a GPS for finding problems in the nervous system. The symptoms on the surface tell the whole story of what's happening deeper inside. But here's the absolute key to this whole diagnostic process. It's comparison. A test is almost never done on just one side of the body. A clinician is always going to check both the left and the right. They're asking, is the sensation the same? Is the strength equal? Your body should be symmetrical. Any difference between the two sides is a huge critical clue that something needs a closer look. So from the incredibly complex dance of your eye movements down to the simple feeling on the tip of your thumb, your nervous system is constantly telling a story. It's a detailed, logical narrative about your body's health, and it's written in the language of sensation and movement. The amazing part is, once you know how to read the map, you can understand exactly what it's saying.